We are back here at 7:30 with a microphone that wants to work. And joining me now live over Zoom is internal medicine physician Dr. Brian Lamb. Doctor, thanks so much for joining us tonight.
Oh, thank you for having me on.
Sorry for scaring you there. So Johns Hopkins
No
University releasing an update today saying that the number of new confirmed daily cases jumped 15% in the past 10 days. What do you attribute that to?
Well, it's most likely America is opening back up again. We're seeing colleges opening. We're seeing schools opening back up. People are traveling more. They're going back to their jobs. They're going back to school. And also, as fall comes out, we're seeing more restaurants. We're seeing people actually out and about and seeing each other. And so anytime you have these situations, you're going to see these numbers increase. It's important to note, a lot of people are calling this a surge, but really to consider it a surge, you would have to think that we had control. We've never really had control in the first place, but we are seeing numbers going up.
What are we seeing locally at Allegheny Health Network's hospitals?
Luckily, locally, we aren't seeing a huge increase in numbers. We do see an occasional day where we'll have higher numbers than the day before, but luckily here in Western Pennsylvania, especially with Allegheny Health Network, we are nowhere near capacity. We're not seeing huge spikes in numbers right now, and we're not really seeing a whole lot of hospitalizations. We're not seeing a huge increase in hospitalizations whatsoever at this time.
That's good. And today, the Dean of Brown University School of Public Health said if you're infected today, you're 30 to 50% less likely to die than those in the early spring. Why is that?
So there's a lot of things. You have to look at the survival rate as, we look at a lot of the numbers and a lot of things that go into this. One, we have better treatment. We know more now about the virus and how to treat it than we did back in March. So we also have more medications. We know what medications are working, which medications don't work as well. A lot of the trial and error has come out of it. So really, as a healthcare perspective, we're much better prepared for this. And that's another thing. We're prepared for these situations. So we're not being overwhelmed. We're not having our resources stretched. And so we are able to effectively treat people. And then one of the last things to also remember is that as far as the survival going up is also our testing numbers. We're actually testing a lot more younger people. We're testing people who aren't in the highest risk group. And so a lot of our positive cases are coming from young, healthy people who, even in the beginning, we knew weren't as high of risk for dying of the disease as, our elderly and our patients who have pre-existing conditions.
Dr. Lamb, thank you again for your time. We really appreciate it.